So hello and welcome to my 6 p.m. talk. Every Wednesday at 6 p.m. in Bali, I give a short talk on various topics related to our mental health, sometimes on my own and sometimes with a guest. And the aim of this talk is to help break the stigma around mental health and talk about the problems we face, different diagnoses, relationship issues, treatments, solutions, and general suggestions. So this talk, however, represents my own personal opinion as a clinical psychologist with 20 years of mental health experience and those of my guests. So all the information shared does not replace personalized mental health advice or treatment. So if you're feeling unwell for whatever reason, it's important that you seek a healthcare professional in your area. So if during the talk you have any questions or comments or anything that you'd like to share, please do, and I'll do my very best to answer. So today we have a special guest that I'm just waiting for her to join us. And perhaps we can have so today our special guest, just before that she's going to be joining us, her name is Dr. Monica Joy Reverger, who's a psychiatrist since 2013. Okay, great, and she's going to be joining us right. So a psychiatrist since 2013 here in Bali, Indonesia. Hello, Dr. Monica.
Hi, Dr. Jeremy. How are you?
Very good. So nice to have you today.
Yes, nice to have you today and nice to talk with you today.
Great. So today we're going to be talking about like a really important topic, I think, a really sensitive one as well, which is around the stigmas around medication in mental health, and perhaps sharing some thoughts and also perhaps what your thoughts are about the topic, and maybe what it is that we can do to maybe help change things for the better.
Yes, true. Because this is a very sensitive things, that to be taught about the mental health disorder, which I think about it that's not only for local but also for foreigner who stays in Bali as well.
Yes, so there's quite a lot of foreigners who are currently living in Bali.
Yeah.
Yeah.
And there are a lot of them also dealing with the mental health problem, and it's hard for them to get through help because of their stigma around their family or something like that.
Yes, yes. Just for our listeners to know just a little bit, it would be great actually if you could just say maybe a little bit about yourself, about your just very quickly about your background, so our listeners know a little bit more about you and the fact that we're based in Bali, Indonesia as well. You know,
yeah. I'm a psychiatrist who lives in Bali. Graduated from University of Indonesia as a psychiatrist in 2012. Then I moved to Bali from 2015. Now I work in Siloam hospitals and also in Prima Medica hospitals. I am a general psychiatrist, so I help adults, I have adolescents, and also help children as well.
Okay, so it's really a very broad spectrum.
Yes.
Yes. And what in your experience, what is it? What kind of, let's say, conditions that you find yourself confronted with or needing to treat the most here in Bali?
Here in Bali, I deal most with the anxiety and depression problem. As well as also bipolar problem, Dr. Jeremy. So it's like that three of diagnosis is the most cases that I see in my clinical practice. I also see the other psychotic patients, but not too much because yeah, sometimes psychotic patients they need more intervention and or they need the in hospitalized treatment, which I cannot provide in the hospital that I work because it's general hospital. So we have to refer them to the mental health hospital. So yeah, that's and also the alcoholic problem and drugs problem is also quite a lot now in Bali now.
Mm. Have you noticed an increase or a difference ever since this pandemic started?
Yeah, since this pandemic, maybe when the pandemic started, yeah, the amount of patients visit to the hospital is decreased, yeah, Jeremy, because
Hmm.
people is afraid to go to the hospital. They are afraid, but after maybe in the middle of the pandemic, the anxiety and also the depression due to the condition of the pandemic is increased, and then I get more referral from counselor like you, and then I get more referral from the local psychologist as well with the depression and anxiety patients. It's yeah more likely like that because and also in the early years in the 2021 the amount of the patients suffering from depression and anxiety due to this COVID condition is increased. I'm sure that maybe you have the same problem as well.
Yes, of course. Definitely. What I've noticed is that at the beginning of the pandemic, I suppose that everybody was just maybe staying at home. We had perhaps some hope that it would be just very short-lived and everything could just go back to normal again. But then
Yeah,
when this was not happening, then I think that's when really things started to kind of shift and become much more difficult and stressful
yeah,
for some people. So yes,
yeah.
absolutely. I have noticed also in my practice that there's been an increase also of people who are struggling as a result of the pandemic itself. So
Yes,
seeking support about this. Yeah.
yeah, true. And we know that this pandemic situation also affects their all of us mental condition from the children in the school age until the people in elderly age. They're all affected by this COVID condition.
Yes, exactly. And I think that a lot of people will be looking at Bali as an island in which, over there it's very peaceful. It's a holiday destination. So, everybody must probably be, feeling very well, and I think that's perhaps one of the misconceptions that people perhaps, from the outside have, about really what's going on here.
Yeah.
Yes. So what do you think about that?
Yes, I think it's also that people that from outside they don't see the what what we are for here, yeah, because it's different, yeah. And also we have a lot of people here in Bali who lose their job, who lose everything because of this pandemic. And sometimes yeah, outside people they don't know or they don't realize how hard is the condition for the Balinese local people or even us who work here. It's also affected with this condition, Jeremy.
Yes, yes, of course, of course. So perhaps we can talk a little bit about like maybe the stigma and the fears perhaps around the medication aspect of
Yeah,
mental health treatment, and what is your opinion about this? Because I'm sure
yes.
you have met perhaps a lot of people who might have had like bad experiences or might really have reservations, and not necessarily feel very comfortable about this whole thing. So perhaps a little bit of light around this would be very helpful, I'm sure.
Yeah, mental health condition is until nowadays still it's not the biggest priority, yeah, for our government. Even now the condition is get better. since we have the mental health law, but it's still, we are still not in the priority. So when it comes to the medication, it's hard to find the good and the proper medication when you are outside, for example, outside Denpasar, for example. Then we
Yes.
have a lot of patients that they have it's hard for them to access the mental health facilities or even psychiatrists or even psychologists, because because the government or the structure is not possible for them. It's like, so we have our psychiatrists in we have quite a lot now, quite okay in amounts, psychiatrists in Denpasar, Bali, but
How
it's
many
still
psychiatrists are there actually in
is
Bali?
around 60, yeah, around 60, but it's mostly concentrate in Denpasar. We are growing now because
Mm.
with the resident of the uh, psychiatrist here in Bali, we are still growing, which is good, Dr. Jeremy here. So, but still, we have also the BPJS, the local insurance. Then
Yes.
it's also covered for the people with the mental health illnesses, which is good.
Wow, that's very
So
good.
yes, so we can get the referral from the first referral, like Puskesmas. So they
Mhm.
can go to Puskesmas and then they get referred to the facilities, higher facilities, until
Yeah.
the first facilities they can get more treatment there, which is good. But the education, we still need to educate more people like this to go to psychiatrists or to go to the mental health facilities. It's not something that
Mm.
something wrong with you. It's something that can be supportive as well for you, because
Yeah.
it will help your life, it will help your family life, something like that. Because it's hard for us to educate the people in the rural area. It will be
Hmm.
hard, it will be
Yes.
hard for us to educate them, to talk with them, because
Mm.
here in Bali, still also the cultural aspect is still
Mm.
also uh, take
Take
parts on
part.
it. Yeah,
Mm.
so
So what do they
we
usually do in rural areas, for example, or when somebody is really unwell with the mental health? I mean, what's their typical approach in not only rural areas, I guess in some other parts of Bali, when they prefer not to actually seek professional mental health help?
yeah, usually they use the cultural ceremony first, but
Hmm.
now with the puskesmas or the first medical facilities which we have in every rural area, so we now try to give the training to the doctors who works there, so
Yeah.
doctor can reach them, the doctor can uh, take action if there is
Mm.
someone that has the mental health issues there, to get
Yes.
help and to bring to the maybe uh, to the nearest town there, and get help from the hospital, regional hospital there, because
Yes.
every regional hospital is now they have the psychiatrist there, which is good.
Yes, yes. I mean, in the history, if we go back in time, psychiatry has always been kind of equaled with, someone perhaps going insane or going crazy. These are like terms that we still kind of use somehow today, and it's kind of still there. So in a way, psychiatry is still kind of very much. Um, I would say still kind of like affected by that history. So I guess through this process of re-education, of information, and going step by step, that helps to break these layers that have been around for a long time.
Yeah, of course. we have until now we still have that problem, Dr. Jeremy. So that's kind of the problem, that if people want to go to the psychiatrist, they afraid to be told that they are crazy or something. So we try to get less. We try to educate people not to talk like about they are crazy, because if they because when I talk to the patient, I told them that it's just like maybe 10 until 20% that patient who comes to my consultation room which has the schizophrenic or psychotic state, and the other is like more the anxiety or neurotic disorder or something like that. So they are they are more willing to come again and talk about their problem and some things like that. Because
Yeah.
if it will lead to the self-medication, which is we will have another problem. We will have maybe drug abuse or drug dependency problem due to uh, their attitude to have the self-medication.
Yes, yes. And that's because they prefer to avoid getting the right professional help because of like their fears or misinformation, actually.
Yeah, even
That they think
maybe.
they can do this by themselves.
Yeah, and they think they can treat it, they can fix it by themselves. They are not aware about this, and also the support from the family or support from the spouse is they don't have the support, so it will lead to another problem usually.
Yes, yes, of course, of course. What happens usually, typically, in like the first consultation when someone ends up actually coming to the psychiatrist office or to your office specifically? What is the typical procedure? Um, and does the person automatically leave that consultation with a prescription?
Not really, Dr. Jeremy, because we have to assess the medical and mental condition as well. If they need to be medicated, I will educate them why they are needed to take medication. But if from the assessment I see and I thought they won't need the medication, I will refer to the counselor like you or the local psychologist if I think there's another uh, underlying case or something like that which need to be fixed, not not treated by the medication. So it's not likely 100% we have to give the medication. Yes, most likely because we are a doctor, so we
Yes.
can prescribe, but it's not 100% every patient that medication. Also, people are afraid, yeah, to have to get or to take the medication, Dr. Jeremy, because they're afraid to get addicted to it. They're afraid about the side effects of the medication. So that's why we have to do more education, because if they go to the therapist, to the counselors, like you, for example, but they have a very severe depression or anxiety, the therapeutic sessions won't be effective for them. We have
Yes.
to first with the medication, and then after they got stabilized, then we can start the non-pharmacological treatment.
Yes, absolutely. This is a very, very important point. Actually, there's several important points you just mentioned there. The first important point is the fact that it's not automatic that the person comes to see a psychiatrist consultation, that they will automatically be go out of the consultation with medication, simply because there's an assessment. And there's so much, I mean, I often hear this from people, even outside of my clinic and even outside of practice, where people automatically, will say, I will not go see a psychiatrist even if I needed to, simply because I'm going to leave the consultation with medication automatically. So there's these things that people have, again, misinformation that people have that makes them resist the process. And in the end,
Yeah.
ultimately, they don't end up getting the right support or the right help. you know.
Yeah, true.
um, you know, this is really important key. And like you said, if we're really really suffering and we're saying I prefer to go the alternative way, or I prefer to come see a psychologist or counselor to kind of start and do this non-medical work, but for some reason I'm unable to be in in a condition where I can actually think, process, talk effectively, because I'm too overwhelmed with my emotions, my thoughts, my chain of thoughts is too blurry, or again like too overwhelming. It becomes very difficult to do any kind of psychotherapy work, as you just
Yes.
said. You know, and this is probably because there might be an imbalance or some kind of deficiency that is chemical, that's physiological, that the person is experiencing, and needs that kind of support, that medication support.
Yeah. Yeah, true, Dr. Jeremy. That's a good point that people has to aware about it.
Mm. There's a lot of people also who prefer to go down maybe a natural route, you know, where they take like supplements, or they check maybe their meals or their, you know, their foods. What's your take on that?
Yeah, I have a lot of patients who already go to the naturopath or something like that, or to the, like what you say, natural remedies or something like that. But as we know as a clinician that uh, all of the illness, or yeah, especially mental illness, there is something wrong in your brain. Your neurotransmitter is not in the balanced condition, so we have to
Mm.
treat. And with the natural thing, we cannot measure it, we cannot count it specifically different from the medication, because the medication already underwent long time of the experiment and trials if, in human as well. So I'm not against that natural thing. You can use it for the supplement, you can use it. But uh, if I think that this one patient is really necessarily needs help from the medication, that yeah, we have to explain to them, because yeah, like people, like they're more likely, like they say that, oh, I'm afraid about the chemical thing from the medication. But I still know that even water is a chemical thing. Even water, even that air that we breathe every day is
We
a
breathe.
chemical. So,
Yeah.
so we have to educate them more about how to, because sometimes you know that, especially I have recently, they use the kratom thing to treat their to reduce the anxiety thing, but then it leads to the addiction part, which is not
Mm.
good. Is
Yes.
then feel more about that. So
Yes.
yeah, it's something like that, that we have to educate more people about the
Mm.
condition, about if yeah, you can use certain supplement, but not too much, and combined with medication, yeah, you can use it, but don't rely 100%, because we have the clinical experience, we have the clinical data, we have the experience, and also we have the trial case, report case about that. So it's different.
Yes, and so therefore people don't have to be suffering unnecessarily because of misinformation, and thinking that the, you know, the mental health professionals are out to do them harm.
Yeah, yeah, they have to think that they have, yeah, that's why the rapport or the connection between patient and doctor, uh, it's the most important thing, Dr. Jeremy. If the patient trusts you, and if the doctor is willing to help the patient, that become the most important part of the
The treat.
the treatment relationship. Yeah,
Of course, it's all about the rapport, the therapeutic
yeah,
relationship. Of course,
yeah.
of course. And so what you were talking about before was the kratom, which is a herbal plant that has certain specific properties that for some people it can be kind of beneficial, but then there's a danger, like you were saying, about an addictive element to it that in the end will not substitute a necessary healing that has to be taking place. If a person has some kind of chemical deficiency or a serious chemical deficiency, that will not necessarily be the solution.
Yeah,
You know, as well as perhaps avoiding or not seeing maybe even a counselor for that matter. So
yeah,
there's proper channels for people to take, but to have the right information to do that.
yeah. True. Now we have a lot of channels. We have a lot of choices, psychiatrists, psychologists, therapists. We
Mm.
have a lot of here in Bali. I think we have more here compared to the other because for the foreigner as well, they can work also with the foreign counselor, which is good. Which is
Mm.
we have a very broad. We have very broad choices here, which is
Choices. Mm.
yeah, we have, which is good, and we know that if we work together, you know that our mental health stigma about mental health will get reduced, and people are more willing to get help about their mental health problem.
Yes, yes, of course, of course. Um, so in terms of like people who, let's say, who don't necessarily have the right support around them, that means family or friends, I guess this is even more complicated for them to know what to do, and of course that is much more troublesome, I suppose. But I think, like you were saying earlier, which is really important in terms of like the difference between neuroses and psychoses, is that there's far less psychoses or cases of psychoses than there are cases of neuroses,
Yeah,
which is so kind of very important
yeah,
for people to know. You know, that
yeah,
means that
of course.
struggling with their anxieties or depression seems to be much more prevalent than people who are having a psychotic breakdown, which can be the
Yes,
result of many reasons, many causes that this can happen. I mean, there's
yeah,
one analogy that I often use with people who I see who are very reticent about even kind of seeing a psychiatrist. And one of the analogies that I will use very often will be that of, if, for example, you happen to be diabetic, your body doesn't produce enough insulin for some reason. Uh, you don't have to stay in this state today in this century. That we can do something about it, and we can give you certain medications that will allow you to produce that necessary insulin and allow you to live a normal life. Similarly, we also have mood regulators that will play in the same way. So if we can actually help our bodies to just to provide them with what they need, then you can also lead again a normal life. Um, Again, for some people, this can be quite difficult because they're just so overwhelmed with their thoughts that
yeah.
sometimes they can't process that kind of information. But this is the analogy that I often use.
Yeah, that's a good, very good analogy, Dr. Jeremy, because I also told my patients like that. Yeah, because yeah, mental illness is something, mental problem is also something that illness, same like diabetes, same like stroke or hypertension, and it can be treated. It can be, we can help with it, and we can do it with the treatment, with the medication, with the combination with the non-pharmacological thing, which is good. So
Yes, yes. So I guess the most important thing is to be able to work also as a team. Like you were saying earlier, if we're able to work together, then we can offer a better or more comprehensive approach to the people who are suffering.
yes,
Um, yeah, and I think that's really an important key. If you were to see things differently, let's say, if there was one thing that you would hope for in Bali in the next few years, in terms of like mental health or mental health treatment or approach, would it be for you, like a step of progress?
Yeah. The first of all, I want here in Bali there will be a more psychiatrists and the more psychologists who are willing to work together, and
Yes.
also maybe a more mental health center in Bali who can. Now we have governmental mental health, yeah, here
Yes.
in,
Hospitals, or is it
yeah,
more like institution or yeah?
institution, so a part of a part of the central hospital, yeah, general hospital. So
Yes.
we hope maybe we can have a good and a big private mental health care center here in Bali, because we know that Bali is known as a paradise here. Bali is known as a healing place sometimes here in
Yes.
Bali. So why
True.
don't we also work in the mental health part?
Yes.
So it will be great. It will be because people come to Bali, they are and they love Bali, even they want to come again and even stay in Bali. So something like that. So if we can do more, it will be
Yes.
great. We can more people from around the world or for all around Indonesia to come to Bali.
Yes, of course. For people in Indonesia and for people, as you said, around the world, simply because Bali definitely has this environment and this perhaps this energy people refer to that is very comforting and helpful, for
Yeah,
sure, for sure.
yeah,
Um, Okay,
yeah. That.
Doctor. Yeah, Doctor Monica. I don't know. I think we've just reached maybe the end of today because we try to keep it within like half an hour.
Mm.
There's always a lot to say. I don't know if there's something else you would like to add just before we come to a close for today.
Yeah, I think it's nice to work with people like you, Dr. Jeremy, a foreigner or local therapist, which is it's very helpful for us because as a psychiatrist, especially like what you say in this pandemic, I very limited my patients because of the situation. So if their need to go to through more like counseling or psychotherapies, I usually refer to the psychologist or counselor, which it will be it's very helpful for us. So yeah, yeah, hopefully that we can maintain this, work together and we can help more people here in Bali with the mental health problems.
Absolutely. Well, teamwork is really the best solution because we
Yeah,
learn so much more from each other. We're able to make a better treatment care. Perhaps
yes,
things that you see will be different to perhaps what other clinicians will see, and so together we form something that is much more comprehensive and really more supportive.
yeah,
And yes, and of course that's important. And the other last thing that we also touched on is that there's lots of foreigners who are here who suffer from mental health. They don't know who to actually see. They don't know who to turn to. Maybe they got stuck here for whatever reason, and so I think. Maybe working in a direction where people know more easily who to go to and who to see, that
yeah,
can be something helpful. And I think talking about it and doing like what we're doing now is helpful.
good. Yeah. Thank
So
you,
so
Jeremy.
so thank you so much, and I really like this conversation. I think it would be great for us to do it again if you
Yeah,
like.
sure.
Yeah,
Yeah,
on
sure.
different topics. Yeah. So I'm just going to end right now just by saying that first of all, to thank Dr. Monica Joy Reverger for being a guest today on this talk and to share her valuable information and insights, which I hope will be very important and helpful to everybody listening. And we together we hope to create more awareness and more importantly, encourage people to overcome their fears of reaching out to break the stigma around mental health, to break the stigma around the about medication in the treatment of mental health, and just saying that this process can be done diligently through assessments, step by step. Okay. And of course, if you have any questions or if there are any topics that you would like to cover for another time, just don't hesitate to message me. You can even message Dr. Monica. I'm sure she will be happy to know that. And so thank you for listening and for following, and we'll be seeing you next week with another topic. So stay safe, everybody. Stay well, and wherever you are, thank you. Thank you, Dr. Monica, again.
Thank
See you
you.
soon,
Bye-bye.
and we will stay in touch as we are, for sure.
Yes. Okay. Bye, Jeremy.
Okay.
Bye.
Bye. See you.
Bye. See you.
Bye. See you.